So, okay, we are revisiting moral injury tonight. So, the last couple of weeks, we've had some brilliant guest led sessions, but each season we have some sessions that are led by us as a team. And sometimes we decide we want to go back and look at a topic. And moral injury is something that we looked at in, was it session 3 that we decided on, Chris? So right at the beginning, the third session that we did together as a group, right back at the start of the first UK lockdown, we talked about moral injury, and Kat shared her experience of moral injury, and she's going to talk about it again tonight. And then we had a whole session on moral injury, but that was number 41. So interesting. We didn't plan that it was going to be like almost double 41 and then 83. We didn't plan that. We just said, I think moral injury is something that we maybe ought to revisit, because we've had a couple of webinars looking at values and ethics, and they've been particularly popular. But I think one of the things that we really need to be thinking about in relation to values and ethics is moral injury. So tonight we're going to revisit moral injury. We're going to look at some of the newer things on it. I suppose my journey around understanding moral injury, because this is really something that I've only been learning about the last 2 years. And since we did webinar number 41, I've learned a lot more about moral injury, and I wanted to share that tonight. So we'll follow the same sort of pattern, really, starting off with what moral injury is. Lots of people will say to me, what is it? Even when I talk about it, they still say, but what is it? So I've tried to be clearer in tonight's session about exactly what moral injury means. I think I posted on Twitter a couple of days ago that I heard some figures that there were 7,000 people left social work last year, and there were more than 10,000 vacancies in social work. And I asked, did anybody have the figures? I've been trying to get the figures and pull them together. And what I can see from the figures, which are really disjointed, it seems to me that that's the figure for UK-wide, so England, Scotland, Wales, Northern Ireland, children's services only. So that's huge. And if you add then adult services into that, it's going to be even bigger. And I am seeing more and more people very early in their career leaving the profession. And I think some of that is because we're not being prepared for things like moral injury. And if you know it's coming, you can prepare for it. I think that helps. So although tonight's probably going to be quite difficult, quite challenging, we're looking at a really difficult topic of moral injury, I think it's something that you do need to be aware of. So what exactly is it? It is a complex concept, really. It's defined in different ways, but let's say I'll define it fairly generally as the sort of harm that results when someone has perpetrated, failed to prevent, or witnessed acts that transgress deeply held moral beliefs. So it's basically about when your values, which, you know, our social work values are very deep within us, our beliefs, and you know, social workers hold those values very dear to their heart. And when we're asked to do something that challenges those values, or when we're prevented from working in a values-based way, or when we witness others transgressing those values, that's what can create a moral injury. It's an injury of our value base, if you like. It's been around for centuries. It's in ancient Greek philosophy. So Aristotle was talking about moral injury, thousands of years ago. But the way that we understand it today comes from the work of a psychiatrist, Jonathan Shea. More than 20 years ago, he identified moral injury and explored the concept and idea of it when he was working with veterans of the Vietnam War. So actually, a lot of the theory and a lot of the literature comes from the military. And that's an issue. I want to revisit that issue later. I was asked on Twitter recently, what do I think about the fact that I'm talking a lot about moral injury? And I was asked, well, what do you think about the fact that all the stuff comes from the military? I think increasingly we're seeing other material, not just from the military, but I actually think it's very relevant for all of us. So we're going to revisit that later. There is some limited literature about social work and moral injury, but it's mostly American, and it relates mostly to social work with veterans rather than social workers ourselves experiencing moral injury. But increasingly there is more literature around, and we'll direct you to some of that tonight. The COVID-19 pandemic raised the profile of moral injury. It's when I first learned about it, but actually it goes much broader than that. And I've learned over time how much more significant it is than just about the pandemic. But Neil Greenberg, for example, and his colleagues wrote a speculative article at the start of the pandemic, raising concerns that healthcare workers were going to be at significant risk of moral injury in the pandemic. And since then, there's been a lot of work in the UK looking at moral injury in healthcare workers. So politicians, governments across the UK are looking at moral injury, but only in relation to healthcare staff. And I think as social workers and social care staff, we have to challenge that. We have to get our experiences of moral injury onto the government agenda. But for example, the Welsh Government Technical Advisory Group has done a lot of work looking at moral injury. There's a paper which, when we send out the follow-up email at the weekend, we'll send you a link to this. It's a free paper to download, but there's a paper specifically developed by the Welsh Government Technical Advisory Group on moral injury specifically. It's about healthcare staff, though. It only looks at healthcare. It doesn't even broaden it out into social care, let alone social work. But this is what the Welsh Government Technical Advisory Group said last year about moral injury. It said moral injury can occur when someone engages in, so that's an act of commission, you've done something, or fails to prevent an act of omission, you've failed to do something, or witnesses acts that conflict with their values or beliefs. And then it goes on to say experiences that might lead to moral injury in healthcare workers include having to make decisions that affect the survival of others or where all options lead to a negative outcome, having to balance one important set of values, for example, caring for patients with an infectious disease, over another, protecting family members for infection. If you just even start to look at this, even those first 2 points, if we take out the healthcare examples, these are things that impact on us as social workers. Social workers are always balancing different sets of values. We're always making decisions where all the options might lead to a negative outcome, and we think about how can we manage that. So these are things that are happening for all of us. Allocating restricted resources to severely unwell patients. Well, if we take out the 2 severely unwell patients and just allocating restricted resources, that's massive for us as social workers. Balancing their own physical and mental health needs with their duty to patients, that's huge for us. How do we manage our own self-care when we've got this overwhelming workload? So this is stuff that's relevant to us as much as it is to healthcare staff, and yet it's not on the agenda. Nobody really in senior positions is talking about moral injury in social work. It also says that there's a sense of betrayal or feeling let down by trusted others, especially when it's perceived as avoidable or they're powerless to change it. So in the pandemic, for healthcare workers, that was things like a lack of availability to PPE, but that impacted on social care staff in the same way. And social workers will often experience a sense of feeling let down by leadership. So this is stuff that's impacting on all of us. The Welsh Government says moral injury can also develop in healthcare workers when they're present at a patient's death, which is counter to their beliefs about how people should die. So, for example, patients dying without loved ones present will have caused moral injury for healthcare workers. But all of this has come out of the pandemic. Governments, senior leaders are only looking at moral injury in a very limited way, just around healthcare staff, but only since the COVID-19 pandemic. And yet in social work, there is a really clear, I think, well-written article. Again, we can give you access to this in the follow-up email, which looked at social work in Scotland and explored moral injury then. And that was 2017. It starts off by saying, and I don't know how to pronounce this, but Boudre, I would go with, writing from his own personal experiences as a war veteran, says that moral injury describes the wounds that a person inflicts on themselves when they inflict wounds on another. It's the damage that's done to your own moral fibre when you do the transgressing. When a person accepts these transgressions, a piece of their moral integrity is sacrificed. And that's the essence of moral injury. Fenton and Kelly then go on to say, we believe the concept of moral injury may be applicable to experiences that are not as extreme or potentially acutely traumatizing as experiences in war. In drawing on these concepts, we want to make it explicitly clear we're not likening the experiences of professional social work practice to the horrors and traumatic events that soldiers may experience, whether within or out with the wartime rules of engagement. However, we do believe that practice in many professions can expose professionals to situations where they may experience transgressive acts that go against deeply held personal or professional values. This exposure to transgressive acts might lead to the development of moral injury, albeit of a lesser order than that which is experienced in contexts of war. Now, don't forget, that was written in 2017, way before the pandemic. The pandemic brought additional trauma and stress into social work. But even in 2017, Fenton and Kelly were acknowledging that social workers were at risk of moral injury. And it all relates to this transgressive acts, what Kelly and Fenton describe as transgressive acts. And I think there are potentially lots of transgressive acts in contemporary social work. If you're on placement now, it would be well worth you considering whether there have been any transgressive acts during your placement, when you're writing your placement portfolio up, when you're writing values and ethics essays up, when you're writing up your ASYE portfolio. If you think that there have been transgressive acts of commission, so have you been asked to do something, or acts of omission where you're not able to do something that have significantly challenged your values. And you could use the chat here to share with one another anonymously and confidentially where you feel that you might have been involved in transgressive acts as a social worker. I think this is becoming more and more common. People are being asked to do things that they just don't feel comfortable doing, or they're not able to do what they really want to do. And so we're going to start off with, you'll know that when we started all of this 83 sessions ago, all of the team were students, and those original team members are now qualified and have gone beyond their ASYE year. So tonight you're going to hear from two of our original team members, Chris and Kat, who were students when we first started, but are now beyond their ASYE year and work in very different settings, don't you? One in children's and one in adults. So Chris, you're going to tell us, aren't you, a bit about your learning around moral injury, because you've been on the journey with me around moral injury, and particularly thinking about transgressive acts for yourself as an adult social worker. So tell us about your experiences, Chris.
Yeah, I'm just thinking about those two slides with the feedback from the Welsh Government and then Fenton and I've forgotten the other one's name. You know, I can really relate to the findings of those, and it's not so much the acts of commission from my point of view, because I think, you know, my experience is that the willingness is there, but it's the acts of omission that are the biggest thing in my current situation. The care crisis, working with older adults most of the time, the care crisis is just huge. I'm in a rural area and the availability of care is just so poor. It really is ridiculously poor. I've been here a long time and I've never known it even half what it is now. And it is really demoralizing, because you know what somebody needs, and you know it should be there, you should be able to provide for that need, and you can't. And you know, actually having to break that news to families and having to share that with them and having to try and find alternative solutions and provide extra support, extra emotional support, and you know, just helping them talk things through and support their family as best they can is really difficult, because you can't give them what you want to give. It's really hard.
Absolutely. And I think it's something that lots of people working in adult social care are talking about at the moment, that huge care crisis that, of course, the politicians have told us it's been solved. The newspapers say that's been solved now, the care crisis.
We've given you
we'll
some
move
money.
on from that. Yeah, that's been solved. That's all right now. But it's a massive issue for people. And, it made me think about even, where the Welsh government's talking about the final point that they said about where people die in ways that, is against the values of the healthcare staff. But that's happening in social care. We're seeing end of life care where we're not able to provide anything for people, even at end of life. Really and so people are dying without dignity. This is a massive issue in adult social care, Chris, isn't it?
It's a huge issue, and I don't know what it's like in more built up areas. It's probably going to be different, but in any rural areas in this country, I think it's going to be a problem. And I think a lot of people who've worked in care before, actually, because of COVID and because of the pandemic, they've probably experienced their own moral injury, and that's taken them away from the profession. And they've gone and found other jobs and other things that are less demanding and pay the same amount of money. And it's really sad, because I've seen fabulous carers leaving the profession and going off and doing other things, and you just think that is just such a sad loss, but I can understand why they do it.
Yeah, absolutely. So I think it's moral injury for social workers, but also for social care staff and all of that around the social care crisis. So thank you for sharing that with us, because I suppose what I'm trying to ask people to do and think about tonight in a kind of guided, reflective way is to recognise that moral injury is very significant in social care and social work. And yet, whenever you hear people talking about moral injury, it's always in relation to health. I would like to see organisations like, for example, the British Association of Social Workers talking more about moral injury. I'd like to see universities teaching more about the concept of moral injury. I'd like us to recognise and own our experiences of moral injury so that we can change that together, so that we can resist it and do something about it together. But when we're not talking about it, it creates a danger, I think. So I suppose really in summarising this whole thing about what is it, and sometimes people are experiencing it and not recognising it, but Rima's work, Rima is based in America, but Rima's work is actually really helpful in a very clearly defined way, breaking down what moral injury means. And Rima says that the moral injury in social work specifically can be a result of 4 different things: perpetrating an act, witnessing an act, failing to prevent an act, or learning about an act that transgress deeply held moral beliefs. And for, Chris is just talking about failing to prevent acts. It's that act of omission. So it's very simple to see that actually this could be happening on a range of levels for social workers. And Rima clearly identifies how in social work, moral injury is a big issue, saying the most challenging ethical dilemmas in social work involve moral injury. We've always got ethical dilemmas, haven't they? But when they're the most challenging ones, they involve moral injury. Challenges occur when social workers are expected to comply with organisational policies and practices that they consider to be immoral. For example, compromised staff to client ratios, inadequate informed consent protocols, unsafe practices during a pandemic, refusal of services to uninsured or undocumented clients. I've already seen in the chat people talking about unaccompanied asylum seekers. And when we think about how social workers are being prevented from working with some asylum seekers, that is a moral injury. And finally, interpersonal challenges occur, Rima says, when practitioners believe that a colleague is impaired or has behaved unethically. So we might see it that we believe that colleagues are acting in unethical ways. All of this is going to create moral injury for us. In terms of the impact of moral injury, it's significant, and some of this we've looked at before. We've looked at some of these things before, but I've added more to it as my own learning around moral injury has increased. We know all of the literature consistently tells us that people who develop moral injuries, whether they're social workers developing a moral injury, healthcare workers developing a moral injury, or veterans from war developing a moral injury, we know that those people who develop them are likely to experience negative thoughts about themselves or other people, and that the most common feelings are feelings of shame, guilt, or disgust. Shale tells us that moral injury damages an individual's sense of their moral self. And I think that's really significant. You know, social work is all about our sense of self, understanding ourselves and how we can use ourselves. And if a moral injury damages our own sense of self, that's going to damage us as social workers. In my opinion, I can't, you know, there's no research on this because it's just not an area that's really being considered carefully enough in social work. But I think it's having a significant impact on the massive numbers of people who are leaving the profession. I mean, the Department for Education last year said that the number of social workers leaving children's services was at a 5-year high. I've worked as a social worker for 32 years. I don't think I've ever seen it like this before. So this is, for me, really significant. We know that it's going to impact on practice and morale. It's likely, I think, to negatively impact on really core skills in social work, like analysis and decision making, really core skills. And according to the Awareness Therapy Centre, who are doing a lot of work with healthcare staff about moral injury, they say that it can result in changes in our sleeping patterns, significant or persistent changes in our behaviour or our habits, making mistakes, isolating ourselves further, compulsive behaviour, and a weakened sense of empathy or compassion. So this is very significant for each of us. This is, the word injury for me is really important. I know in social work, a lot of people have been saying, we don't want to talk about an injury, we'll talk about ethical distress or ethical stress. I think they're slightly different to moral injury when we look at it, and the literature, if you want to get really picky, would kind of say ethical stress and distress is at one end of a continuum, moral injury is at another. But why are we avoiding the use of the word injury? Because this is injuring social workers. And I think that's what we need to be considering. So if you were to think about what might create a moral injury for you, the starting point really for my learning about moral injury came from an article at the start of the pandemic written by Neil Greenberg and his colleagues, where he highlighted the potential for moral injury in healthcare workers. And I mentioned this at the start of the session. And they identified 3 things that they thought would raise the risk, if you like, of moral injury for healthcare workers. And they talked about thinking about how to allocate scant resources to equally needy patients. That's their wording, not mine. Because healthcare workers, they said, would need to balance their own physical and healthcare needs with those of their patients, and because they would need to make decisions about how to align their duty towards patients with their duty towards their own family network. Now, we talked about this in our 3rd webinar. This is how long that we have been talking about this. Tonight is our 83rd webinar. In our 3rd one, we talked about this and we quoted that article from Neil Greenberg. And so for me, reading that article was really the starting point for my own learning about moral injury. But now I recognise it clearly at different points of my own career. And I'm seeing it in so many new workers that I am hugely concerned. I think I experienced moral injury 2 years into my social work career. I was working in a children's services team. I was working with, because I was very young, I was working with lots of young people because my manager said, you can engage with young people much better. I was working with lots of young people, and I was asked by my manager, in fact, told, not even asked by my manager, to describe some of the young people that I was working with as child prostitutes. I refused to do that. I was told that I had a learning need, and I was sent on mandatory training course, which was called child prostitution. Now, the large national children's charity that ran that course, called Child Prostitution, now denies that they ran that course, but I have the certificate to prove that it was a large children's charity that ran that course. I left children's social work and went to work in adult social work for a number of years after that, because I got to the point where I couldn't argue anymore that I was refusing to name those children in that way. There is no such thing as a child prostitute. There has never been any such thing. There are just abused children. But the course that I was sent on was seen as if you like, the idea of the day, what should be done at the time. And the reason that I'm telling you this is because now, almost 30 years on from that, we can all look back at that and say how dreadful, how terrible, how obviously wrong it was. But there were social workers in training then who were on that course, who believed what they were being told. You've got to question everything. That's what professional curiosity is. Don't just take what you're being told on face value. If your manager says to you, this is what you have to do, if it does not sit comfortably with you, then argue that, resist that, disrupt that. Some of the things that we've been trying to share with you in these webinars are going to be really important. You've got to be able to think to yourself, in 20 years' time or in 30 years' time, when you're like me looking back, in 30 years' time, can you feel comfortable with what you did? And I feel comfortable with everything that I have done, every act that I have taken as a social worker, I feel comfortable with. But there are things that I would refuse to do, and meant that I moved teams, meant that I moved jobs. I didn't recognise that then as a moral injury, and I think it would have been helpful to me had I known about it. So I'm hoping that you knowing about moral injury and recognising it in yourself will be helpful to you. We have shared throughout these webinars some of the things that social workers have told us about during the COVID-19 pandemic. I've even been asked by other people if they can share the following slide, which is a very potentially distressing slide. So I want you to be conscious of this. I want you to know that if you need to switch off or you need to step away from the screen or whatever, then do that, you know. If you need to just mute the button for a minute and look away and come back in a short while, do that. Whatever you need to do to look after yourself. But the things that I'm going to share with you now are things that students and social workers have been saying through the last 2 years. Some of them are from 2 or 3 weeks into the pandemic. Some of them are from 2 or 3 weeks ago. So they spread. The whole of my learning around moral injury is spread across these quotes, if you like. I've got permission to share them, but these are real quotes. These are not made up for training purposes. This is what social workers have been experiencing. A social worker working in bereavement services who said to me at the start of the pandemic, I'm sitting here doing death and dying at my kitchen table. It feels really different here. She had 20 years of experience in palliative care, and yet it was completely different for her doing it sat at a kitchen table. People talking about their own children hearing the trauma. You know, you can see Chris and Kat there on screen with their headsets on, but we can't kid ourselves that when you're wearing a headset, your own family can't hear what's going on because they can hear what you're saying. And if you've got children or anybody else around you in the house, you've got to be conscious of that and think about what's being heard and think about the secondary trauma that we're bringing into our own homes. People telling me I'm doing what I can, but it's never going to be enough. And I just keep asking myself, how am I going to get over all of this? Students asking, how are you supposed to learn about your profession? I'm just sitting in my bedroom in the middle of a global pandemic. I feel like I'm watching it online and it's not enough. There are people 3 years into their social work training who've not yet had a physical placement. Didn't know if you wanted me to name who you were there, but we've got team members who are, you know, effectively learning about the profession virtually online. People telling me I feel like my home's been invaded. How does it feel giving evidence at court of protection, standing in your bedroom? When this is all over, I never want to come in this room again because of the things I've seen in here and done in here. How do you change? How does it change from your work environment to your home environment? That safe space that we all had. Even thinking about things like attachment theory and the fact that we all need a secure base. Our secure base can be lost when we're bringing our work into our home. People who don't know how tall their colleagues are because they've never met them physically. You know, people who are still now working with teams that they have not met. People telling me about not getting any warning, opening notes, reading about, you know, horrendous child sexual abuse surrounded by their children's belongings and feeling like they've brought that somehow into their home. A sense of abandonment from social work leadership. Loss. Bereavement. How much support have you had to think through the losses that you've faced in the last couple of years, both personally and professionally? But perhaps for tonight, what's really important thinking about moral injury is people are asking things like, looking back now, I don't know how I justified some of what I did at the start of the pandemic. And I'm asking myself, why did I do that? We know that some of the early findings around what happened in COVID have focused largely on the experiences of people being discharged from hospital into care homes who weren't tested. And we know what happened and how COVID ran right through those care homes. Fairly recently, a fairly young, newly qualified social worker talked to me about feeling haunted by moving somebody into a residential care setting. It was a woman who'd been married for 72 years and she never saw her partner again after that social worker's intervention. And to carry that as a social worker is huge. That transgresses every aspect of our morals and our values, and that is moral injury. That's not moral distress, not ethical distress. It's not just stress, it's an injury. When you're carrying it, when you're being haunted by it, it's more than distress. It's an injury. And I think we need people to recognise that. We need leadership to recognise that. We know, don't we, that social work during COVID-19 has been really significant. We know that Sarah Banks has been talking about this very widely and has done a lot of work with both BASWA. I mean, one of the things I found really helpful at the start of the pandemic was the BASWA PSW magazine and the ethical guidance being given within that. I do think being a BASWA member during the pandemic has been helpful from that perspective. Sarah Banks did a lot of work with BASWA and the International Federation looking at social work in the pandemic. And she describes in an article, Sarah Banks and Rutter describe social workers feeling unable to practice as they wanted to during COVID, describing it as anti-social work because of restricted relationships with people, the inability to offer people their usual legal rights and services, being unable to safeguard people in the usual way, feeling unable to offer services which could promote independence and improve quality of life, and terminating services for people who still needed them. Social workers reported feeling powerless and exhausted, and that's a word I've used a lot in these webinars, you'll know. Social workers talked about an inability to pursue an alternative course of action, feeling a sense of a lack of opportunity to have conversations with peers and managers, being remote from colleagues and being unable to give feedback to policymakers. So social work during COVID has definitely brought about moral injury, but it is important to recognise this isn't just about COVID. Fenton and Kelly's article, 2017, I'm going back to that time and time again to show you this isn't just about COVID. They said moral injury can result from social workers being exposed to sustained ethical stress, the stress experienced when workers cannot base their practice on their values. That's simple. It's an easy way of looking at it. When you are unable to base your practice on your values, when there is a dissonance between those two things, it will create potentially a moral injury. And we know, aside of COVID, social work is stressful, ethically stressful, and traumatic at times. I go back to and love this quote from Naomi Remen. The expectation that we can be immersed in suffering and loss on a daily basis and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. You are going to get wet in social work. Some days you're going to get soaked through to the skin. And you've got to think about wearing the right kind of protective clothing. You've got to think about how you manage to do what that little dog's doing there, keeping his head above water. How do we do that? Moral injury is a particular risk at times of crisis. And, you know, David's brilliant illustration there shows that. But it's not just the COVID crisis. Chris has already talked about the social care crisis. I've mentioned we've got this huge staffing crisis. There are teams that are operating on half the number that they should. Most local authorities are reporting being at least one team down in terms of the number of vacancies that they're carrying. There is a massive staffing crisis in social work. We've got the cost of living crisis that's going to hugely impact. We're only seeing the beginning of that now, but just, you know, that's going to massively impact on us and the people that we support. So we're always working with crisis. And you know that I love theory. I think it's important to just take a look at that basic crisis theory. When we're dealing with crisis, it's one of the oldest theories that we've got. Kaplan, 1960s, talking about crisis, said there are 3 stages. There's the initial impact, there's the recoil, and then there's adjustment and adaptation. Now, I think this is really helpful to think about the COVID-19 crisis, you know, and how it impacted on us. And I definitely recoiled. I remember thinking, I'm never going to do any training online. Who's going to be interested in theory in the middle of a global pandemic? I was able to move on because this fabulous group of people here in the Social Work Student Connect team helped me to move on. So I can see how useful this is when we think about the COVID-19 pandemic. But I don't want us to adjust and adapt to the staffing crisis and the social care crisis. I want us to resist that. I want us to disrupt that. I want social workers to come together, and we need a really clear collective voice about this to change it, not to adapt to it, not to think, well, I'll just keep my head down and get on with my job, because that's not going to help. But in terms of thinking about this in relation to the COVID-19 pandemic, that recoil stage where I remember the whole impact of COVID for me was on World Social Work Day 2020. That was the day I started to shield. I remember it very vividly. And I remember going into a recoil because all training was cancelled. Student placements were cancelled. My role as a practice educator stopped, you know, everything. And I do remember being in a stage of recoil, kind of paralysing myself, not knowing what to do, not knowing how to respond. But actually now I'm able to reflect on that as being quite a helpful stage for me at helping me to get to that adjustment and adaptation. But lots of social workers and social care staff didn't recoil. They reacted and responded in the moment of crisis. And that's where a lot of moral injury happened. Because the thing is, recoil can provide safety. Recoil can give us a safe space to think about the threats. Just think about the natural world, you know, the tortoise and the turtle and all that, the natural world. When faced with threat, they go back into their shell. They retreat and they think about how to respond to the threat. And that recoil is helpful because it gives us space to think. And Sarah Banks' work that I've referred to, the work they did that she did with Basworth, was on slow ethics and the need for slow ethics in times of crisis. So I'm going to suggest that one of the ways of thinking about moral injury is to slow ethics, is to think about, remember the tortoise, kind of retreating, just thinking about when we're faced with that potentially transgressive act, retreat back into your shell, slow the ethics down. Go to the Basworth Code of Ethics. Keep focused on human rights, social justice, and your professional integrity. Go to those ethics that we've been exploring, that we've been looking at. And also go to the International Federation of Social Workers ethical guidance. I know I keep telling you about this, but if you're a student, this is the thing to be referencing in your ethics assignments. This is the thing to be going to. This is international guidance, primary source, very easy to relate to and connect to. But it talks about, and it presents in this new guidance, a new threefold ethical framework, which begins with ethical vigilance, being alert and sensitive to the ethical dimensions of practice when you're under pressure. and acknowledging that this entails a heightened awareness of our own stress and exhaustion. Because when we're stressed, when we're exhausted, then we do have a tendency to rush, to potentially make judgmental remarks or fail to see potential harms or infringements of rights. Rushing will create moral injury. When we're short of time, and that's what we're going to be looking at next week, the temptation is to rush, but it will create a moral injury. It will not keep you safe. It will not lead to ethical practice. So take a look at this threefold ethical framework. I'm not going to read it all out to you. We've explored it in previous webinars when we did the ethics webinar, Back to Basics, fairly recently. But ethically reason through what you're doing. You know, think about how to balance needs and rights and responsibilities and risks, and keep on returning to human rights, social justice, and professional integrity. And then work in an ethically logistical way. But we've talked about moral injury in terms of situation, in terms of COVID, in terms of crisis, but it's also impacted by the environment, very significantly impacted by the environment. We recognise the impact of the environment on people because that's what social work does. You know, it takes a person in environment perspective. We look at the person in the context of their relationships, community, and society. We have to start to look at social workers in the context of their team, their organisation, and the wider profession. We've got to look at students in the context of their course, their university, and the wider profession. We've got to see that bigger picture. And we have to recognise that a lot of social work working environments are not great at the moment. You know that I love Caroline Aldridge's work and her book, He Died Waiting, and we've had Caroline as a guest at our previous webinars. But this is one of the extracts from Caroline's books that I use the most and I go back to again and again. Caroline says this: there seems to be a prevailing philosophy of expecting social workers to be robust enough to cope with whatever the job requires. It's unsurprising that the burnout rates are so high. Apart from impacting negatively on the retention of experienced staff and being morally questionable, this attitude influences the way that practitioners work with those people who need services. Emotionally barren organisations set the tone for chains of poor emotional literacy. Leaders need to role model sensitive and attuned practice if they want their staff to treat the people who use services with respect and compassion. Now, I'd never heard the phrase emotionally barren organisations before. It's one that Caroline Aldridge developed. And yet, when I read it, I knew it straight away. I recognised it. I've worked in emotionally barren organisations. That one I referred to earlier, that was an emotionally barren organisation. I've sat in emotionally barren supervision sessions. We all know what that looks like and what that feels like. And it's those emotionally barren organisations that will exaggerate the risk of moral injury. And Caroline wasn't writing about moral injury in the book, and yet she uses the phrase morally questionable. So we can see that this is about morals. It is about something more deeper, something different. We need to be talking about moral injury. So we know that environments have been really significantly impacted. We know that students have been, empty lecture theatres, empty offices. We've been on our own. We've been working alone, dealing with really difficult, complex issues in our own homes. People have been talking about working from home. I think we should call it living at work because the boundaries have become so blurred. Increasingly now, lots of local authorities and lots of employers are asking people to continue to work from home. I know that people are telling me that they're told there has to be a reason for you to come into the office. And you can't say the reason is I want to be surrounded by my colleagues. Well, actually, social workers hold risk, and we often hold risk together. And when we're alone, we're holding risk on our own. And trauma and space are connected together. We know that. We know that the ease of trauma very clearly identify environment. Trauma and space are connected. we are bringing our work into our homes, potentially into our families and whoever we live with. How do we avoid secondary trauma impacting there? There's all the limits in terms of situated learning, situated support, just being surrounded by and listening into people and feeling supported by just being there. We're losing a lot of that. You're taking those really difficult phone calls where people are phoning you up, and like Chris talked about earlier, probably people phoning Chris up saying, why haven't you got care in place for this? But why, and it can be potentially quite difficult, challenging, conflictual. And you're dealing with that sitting at your kitchen table or sitting in your bedroom, or this is a different world. And I believe strongly that our employers and our educators have a responsibility to support us in creating reflective and emotionally safe working spaces. And that takes us to Kat telling us about her experience, because in webinar 3, Kat shared with us her experience, and I often think of it in relation to an example of moral injury that in many ways is almost the literature. Your example, Kat, isn't even in there, but it's a clear example to me of moral injury. But it's more about transgressing a transgressive act around your family, isn't it, in a way? It's not even referred to in the literature, and yet it's a very clear example of moral injury. So I'm going to hand over to you, Kat, to tell us about your story again and maybe build on it.
God, I can't believe that it was webinar 3. That seems like a very, very long time ago. And I guess it was because it was probably around this time 2 years ago. At that point, I was on my final placement. If we went back to kind of January 2020, I would have been starting my final placement in a mental health team, coming from an older adults background. We ended up getting an email one day, myself and Chris, because we were on placement at the same time, to say that we were being pulled back to our substantive posts, and we ended up having to go back and work from home. And during that time, I was having to homeschool my boys as well. So I've got 2 boys, and trying to juggle working from home with both myself and my husband and homeschooling was extremely difficult, especially trying to have a final placement and deal with everything. We've heard from Chris about how difficult it is, and taking those phone calls from people who are in crisis and dealing with things during the pandemic and deaths from COVID. And the particular experience that we are referring to is sitting at my kitchen table and working and taking a really sensitive phone call about speaking to a family member around COVID related death, safeguarding concerns, and sitting at that point in my other home, having the patio doors in front of me, and my children were out playing in the garden because it was break time during the homeschooling day, and I was on a phone call. My husband was in the front room working as well and on a call, and I just remember having that difficult conversation, really sensitive, and hearing one of my boys crying. So he cried out, the crying continued, sounded as though he was in pain, and I'm thinking, what shall I do? I literally can't get off this phone call. My husband can't get off his call. My son is in the garden, obviously hurt. And I had to carry on with the phone call. And it's so difficult because people all the time say, you need to put these boundaries in place. You need to ensure that you're putting your family and yourself first, and self-care and everything, and ensuring that work doesn't blur into your home life. But during the pandemic, and even now, those lines they're not even there. I carried on working throughout that time at the kitchen table, working sometimes till 8 o'clock at night, on weekends, bank holidays, talking about awful things with my children around. And it was so hard to be able to switch off. Myself and Chris have had conversations about, our children saying, you need to turn the laptop off now, mummy, And how difficult is it to remove yourself from work when it is in your home? And having to put that first was really difficult. And it's something that I always think about. luckily he was fine. You know, only a little scratch or whatever from falling over in the garden, but just horrendous about how we have had to manage and juggle and prioritize things during the pandemic.
Yeah, I agree, Kat. And I think, you know, it was really clear in the pandemic because it was so new for us to do it in that way, working from home, wasn't it? But I worry that as people have adjusted and adapted to working from home, they're almost like becoming a bit oblivious to the fact that actually their children are surrounded by this and are hearing this and are, and you know, what are children seeing and hearing? And even if it's just, shh, don't do that, you can't, I'm on a call, or even if it's just being shushed in their own home, or
I had exactly the same thing earlier when I was on a call, and I'm thinking they can hear what I'm saying, and I'm talking about, you know, situations and things. They can't hear the person on the other end, but they can still hear what I'm talking about, and we're talking about some really significant, you know, child protection concerns at times for me. I don't want my children listening in on that. I always remember you talking about when you were stayed up late writing that report, and one of your girls were ill, and her looking at something and saying, what does that mean? And without knowing, they are surrounded by this.
They are. It was the thing that stopped me working from home. So yeah, she's 30 now, but I think she was about 7 at the time, 6 or 7 at the time, Fliss, and she was poorly, and I was staying up late. It was a report for court the next day, so I had to do it, and she was poorly, so I sat her on my lap and trying to get her to sleep and typing with one hand. And it was when she said, what does that mean? I think it was actually a word of sex or sexuality or something, and what does that mean? And I just thought, I can't do this. You can't comfort a child and write a report at the same time. You can't do it. It's not possible.
No.
So yeah, I think moral injury extends into our families, and I don't think the literature is illustrating that at the moment. Or maybe we could describe that as a transgressive act that, you know, goes against our own values, but it's less of our professional values and more of our personal values or family commitments or whatever. So thank you for sharing that, Kat. And I remember you sharing it at the time because you said that I think it was Neil Greenberg's article when I talked about those 3 things, and you said, yeah, that's happened to me this week, and that's how it came up.
Yeah.
So I think it illustrates moral injury from the start of the pandemic. The good news, though, is that there doesn't have to be a long-term consequence of this. So, you know, it's not going to impact on our children growing up. It's not going to potentially, but only if we're thinking about it. So the Awareness Therapy Centre say this: long-term negative consequences of morally injurious events are not inevitable. Although exact data isn't available, it's likely that most workers who experience moral injury will not have long-term negative outcomes. In fact, after potentially morally injurious experiences, some people even eventually develop a redefined meaning in their life. And with time and support, they can begin to incorporate the experience into growth or into helping others. We know from the literature, from the research, that there are 6 things, clear things really, that can mitigate the impact of moral injury. Now, most of this research comes from the military. There's a little bit of it from health, but most of it I'm drawing on here is from the military. And I'm pointing that out for a reason. There are 6 things here. Team working, a sense that you belong to the community of practice, which is why remote working can be so problematic. A strong reflective culture, and that should be embedded at every layer within the organisation. Good quality, emotionally supportive, reflective supervision. The opportunity to do in-depth reflection with a particular focus on your feelings and your emotions. Education about the potential of moral injury is important, and a permission to talk about it and explore the depth of any injury with your colleagues, and a clear recognition of the importance of your work and value being placed on it. Those 6 things matter. Now, we could spend a whole webinar looking at those and unpicking them and saying, you know, we're not valued as social workers. Even the fact that we're not referred to in the government literature about moral injury shows that we're not being valued as social workers, because it's not even being recognised, the impact on us. All of that, we could pick it all apart. But for me, the key thing, you know that I do a lot of work on theory and reflection. And 3 of the 6 things here are about reflection. Now, if I said to you, how would you categorize the military? Nobody would say, oh, they're very reflective, you know, because the military don't want you to reflect. They just want you to follow orders. And yet, even in that context, 3 of the 6 things are about reflection. So that's why it's so important as students, you learn that ability to be reflective. We also need to talk about moral injury. And Esther Murray in her blog, she says this: the best support we can offer right now is honest, open conversations so that people can feel heard and validated in their experience. That is what will help to get them through. Once we're through it, there will be different work to do. Whenever I've spoken about moral injury, there have always been people in the audience who've breathed a huge sigh of relief because there's a name for the way that they're feeling. It's no different now. We really do need to find ways to talk about how we're feeling, both the good and the bad, so that we can bear it. It's silence that will do the harm, not talking. And there's a few things on there that worry me. One is, I think there is a real sense from senior managers, particularly within social work, of let's just keep everything positive. Let's just keep everything positive. Let's just tell everybody they're doing marvelously. Let's keep it all positive. It's a real toxic positivity. We have to have the opportunity to talk about what's not going well as what is going well. It's really important that we can talk about both the good and the bad. And it's important that this isn't silenced. We know, don't we? We talk a lot about anti-racist practice in our webinars. We know of the danger of white silence. We know of the danger of silence generally. And so we need to stop being silent about this. Banks and Rutter say that we can resist moral injury. And that's important, a resistance about this. They say that we can resist it by raising with employers, professional associations and policymakers the serious harm and inequity experienced by people during the pandemic and the difficulties we've had in delivering social work services. We can resist it by making proposals for improvements and by engaging with the COVID-19 public inquiry to raise the serious harm and moral injury that's been caused. So we need to resist this. We need to come together to resist it. I think one of the things that I've found really helpful about Rima's work, as I said, American-based, but one of the things I've found really helpful in reading around moral injury is Rima's work on moral courage. So in Rima's article, he references Kidder and Bracey, who say moral courage can be defined as the quality of mind and spirit that enables one to face up to ethical dilemmas and moral wrongdoings firmly and confidently without flinching or retreating. It enables us to face up to problems, not necessarily to resolve them, and certainly not to promise that we'll master them, but to address them squarely, frontally, and with determination. Moral courage requires action that is both firm in its persistence and confident that the tools, the moral, mental, and emotional elements of argumentation and persuasion are sound enough to weather serious resistance. We need to use our moral courage. Social workers have huge amounts of moral courage. Read what that is. You do that every day with service users. You firmly address issues. You don't shy away from difficult scenarios. You have moral courage every day, and we need to use that and draw on that to move away from moral injury. When I was looking for an icon, an image to put on the slide, because you know I like lots of images, and so to try and put an image on the slide, I just did an icon search on courage, and that's the icon that you get when you search courage. It's interesting, isn't it? Loads of stuff tonight has been about fighting. Swords and shields, how do we shield ourselves, and how do we resist, and resistance, and a lot of the literature on moral injury coming from the military, I think works, because I think we need to fight as social workers now. I think we need to fight for values-based practice, but we need to do it together. We cannot fight for values-based work alone. We have to connect with other social workers. We have to have strength in multiple voice, if you like. And the other thing that I think is really important and is really key in addressing moral injury is kindness. And that's why we've been talking a lot about kindness in our webinars, and it's why I'm working at the moment with Caroline Aldridge on the concept of kindness in social work. So to summarize, I wanted to revisit moral injury because my learning about moral injury is growing all of the time, and we've revisited Kat's very early experiences of moral injury, and now we've looked at Chris's experiences of moral injury as a result of the care crisis. We're revisiting this all of the time. I don't want to tell you about this as students to terrify you. You know, I'm looking at team members like Kai and Jenna who I'm gone out on placement, and I'm not telling you about this to scare you or to put you off, because social work is the best profession in the world. It is such a privilege. And there's so much that we can do. And I still love social work 32 years after qualifying. But we also have to be equipped and ready and know the challenges and be aware of how to address those. And we can only do that together. So my advice on really addressing moral injury is, as social workers, we need to be aware of what we're doing, why we're doing it, and how it's impacting. I always talk about the what, why, and the how. To do that, you need to be curious. You need to reflect on what you're asked to do. Don't do something simply because it's the next step of the process or it's what my manager said to do. Reflect on it. Report on what you're not able to do and make sure that that's clear. You know, we all know the social care crisis is massive. We just keep being told by politicians it's been solved. It doesn't equate. We've got to report on what we're not able to do. You need to understand the purpose of your work and connect that to practice. So what's your purpose? What's your reason for being a social worker? And when you focus on that, you'll find that every day in your practice. And that will mitigate the impact of moral injury. Challenge where necessary, whistle blow when you need to. Build practice that's based on professional values. Probably more than anything, connect with others. This team is called the Connect team because it's all about creating connections on so many different levels as social workers. But you need to connect with one another, and you need to think about how you're doing that. And maybe most importantly, whenever you're doing something, ask yourself, will you be able to defend your practice in 10 years' time? Because that's what being a professional social worker is about. Sometimes being a professional social worker and being an employee of an organisation can come into conflict. You're professional first. So ask yourself, in 10 years' time, am I going to look back at this and regret it? Because I don't regret anything that I've done in social work. And I think it's important that you can live with that. And that's what professional integrity is about. So thank you for coming tonight. Moral injury is important. It's probably, actually thinking about it, one of the only topics that we have directly revisited. You know, we've revisited lots of theory in different ways, but this is probably the only thing that we've directly said, right, we've already done one webinar on this, but we're going to do another one on this topic. Because for me, I think it's really important. And I'm going to leave you with the work of Rima, because I think it's a really helpful quote. Rima says, being a social worker requires a remarkably unique combination of principled commitment, integrity, and skill. Over the course of a career, social workers are likely to encounter instances of moral injury. Ideally, these professionals will have the wherewithal to recognise moral injury when it occurs, to identify the contributing factors, and to engage in meaningful efforts to prevent harm in your own life, in your organisations, and in the broader culture. And I'm hoping that tonight's learning has in some way helped you to be able to think about that, to think about recognising moral injury and identifying contributing factors. The references are there. I'll leave them there in case you want them, but in the follow-up email, we'll probably send you that list. I think I'm looking at Diane Kultuma, but I think they'll probably send out the references, and we'll send you links to some of the material that we've referred to tonight. We've got some brilliant sessions coming up for you. I think Kai tweeted last week about the quality of the webinars. The first 2 weeks of this season were brilliant, and I do think we've got some really good sessions coming up. Next week, we're going to be looking at time management, which is a forever issue for us, isn't it, as social workers? And we've got special spotlight guest Kaylee Rose Evans. The week after that, we're going back to basics again with relationship-based practice, and then we're going to be looking at social work and mental health as a context session. So there's lots of different topics coming up for you over the next few weeks. I'm sure that in the chat, the team are putting the link for next week so that you can go straight there and register for us if you want to register straight away for next week. But thank you for coming tonight. It's been a tricky topic. It's very emotionally challenging, I know. So go and do something you enjoy. I'm going to go and eat a curly whirly and probably watch the sewing bee. So I think we all need something to wind down at the end of the day, get the boundaries in place. But thanks very much, and hopefully we'll see you next week. Good night.